All right. Well, again, thank you so much for showing up and sharing your wisdom and your passion and who you are today. I really appreciate the time and I'm so excited.
Thanks. A pleasure to be here.
Yeah. And first and foremost, how would you like to introduce yourself to our listeners?
Well, um, it's never a simple question, is it? I'm a psychologist and a sleep and dream specialist. A lot of my work has focused on an integrative approach to sleep and dreams. So I started a sleep program at Canyon Ranch many years ago. Um, and there I met Andrew Weil, and I've been on his faculty for the past 25 years as the sleep and dream specialist. And that covers it.
Yeah. And may I ask, did you have a personal or professional interest in sleep, or did you just find yourself there working with sleep?
When I hear that question, I always wonder, why isn't everybody much more interested in sleep and dreams? Some people are. I think a number of things kind of directed me into that specialization. One was um, I got interested in psychedelics as a teenager. It was that time, that era, and I actually had a short conversation with Timothy Leary, who encouraged me and a buddy to experiment, and that got me interested in dreaming overnight. I'd had dreams and nightmares, and I also had some experience with sleep paralysis when I was in graduate school, and freaked me out. And I got interested in that. It was the first of my many misdiagnoses. I diagnosed myself with narcolepsy, and I was wrong. Uh, Most people who have sleep paralysis do not have narcolepsy. Probably a really big factor was my parents. Both of my parents were Holocaust survivors. And, I knew no better. I mean, that's what mom and dad experiences were like for me. But when I got to graduate school and I got interested in trauma and PTSD, and recognized that both my parents had that, but neither of them had one of the most common symptoms of PTSD, which is insomnia. They both slept surprisingly well. And in retrospect, I realized that there was a family value that was hardly ever spoken, but it was lived, that sleep was sacred. It was just sacred. And there was a place for dreams and nightmares. My mother would talk to me about her dreams, and I would share dreams. So I just assumed that this is how life was. And here I am.
I love that. And I remember in one of your books, which I can't remember which one, but you did talk about your mom and how she shared what the best time, I think, how did it go?
Yeah. Yeah. She'd play this game and she'd ask, what's the best thing in the world? Right. Yeah. And, as a kid, I knew, right? I'd come up with the kid answers and ice cream, television, toys. And she'd go, no, 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 no. And I knew what she was going to say because it was one of those games she played over and over again. And she would variously say sleep is the best thing in the world. Sometimes she'd say night is the best thing in the world. And I'd argue with her, because couldn't play. But it really stuck with me. And I mean, years later, I put it together with the fact that she was, at age 14, she was ushered into a concentration camp. So night and sleep. And I think the same for my dad. He was older, but they really came to love that, not just as a respite, not just as an escape, but an actual real place. It wasn't just getting out of, it was getting into, which I think is so relevant to how we look at sleep and dreams today.
Yes. And that story struck me because that's definitely not something I heard growing up. Really, the only thing that I was trying to think about that when I was reading it, and I was like, oh, it usually was like around anxiety or some kind of like you got to get to sleep or it's bedtime, and like there was like a lot of weird, a lot of anxiety and fear and like almost like something that you just had to get into, and right, and this kind of leads me into um, a lot of what I've learned about from your writing is that healthy sleep is like pretty much requires a paradigm shift, right? Like a fundamental shift in our perspective
Yeah.
and basic attitudes. And I'm really curious of that paradigm shift of like transforming the way that we think about night and sleep in general.
And it actually begins, those transformations begin with a consideration, a humble consideration of our perspective. I was thinking about this R.D. Laing poem. He says, the range of what we think and do is limited by what we fail to notice. And because we fail to notice, there's little we can do to change until noticing how failing to notice shapes our thoughts. And this is about dreaming, and it's about consciousness. It's about realizing, hey man, I see what I see, I feel what I feel. There's always more out there. There's always more. And to not tightly, rigidly frame our experience, which we do. And I'm writing more now about something I call wake centrism. Wake centrism is it's like water to fish. Most fish don't believe in water. Back in the late 60s, when we were experimenting with psychedelics, we talked to fish. And, if you try to convince a fish that you say to them, there's this thing that you're in, it's all around you, you live in it, you breathe in it, you excrete in it, you everything. The fish goes, yeah, right. Yeah. Not until a fish happens to leap up out of the water and goes, oh my God, it comes back to its buddy, says, there's this thing, it's unwater. And we don't really get the unconscious. We have language for it, but we don't really get it. Until we get unconscious, we can't get conscious. And our water is wake centrism. It's like the matrix. I call it the wake tricks. We live in this place. We think waking, what we're doing now, that this is it. This is all there is. It's the gold standard for consciousness. It's the center of the universe. I think people believe that one day they're going to die, and then they're going to wake up like they wake up in the morning to the same kind of consciousness. Here I am. And one of the reasons it's important to get that we're stuck in waking, a number of reasons, but one of them is that we look at sleep and dreams from a wake-centric bias. We think of sleep and we think of dreaming as subsets of waking. The only reason I really need to sleep is to be a better waking person. And I need to dream so that the dreams can more inform me about waking life. And there's truth to that. So virtually all sleep research asks the same questions. It says, hey, sleep, what can you do for me as a waking person? And sleep is wonderful. It says, yeah, man, I'll make your life a lot, I'll improve your memory. I'll improve your immunity, your health, your longevity, on and on and on. Does good things. And dreaming in a similar way, REM sleep in a similar way, dreaming in a psychological way. But the presumption that the only reasons we need to sleep and dream is to make us better waking people, we miss the point. Sleeping and dreaming improve waking life, but they also are portals. There's this permeability, they're doorways to expanded consciousness. Ooh.
Yeah, that definitely is so different than the way that I was trained to look at just humans in the mental health world in general. For example, it's like saying that you need to understand the mind without understanding the body. And that's almost impossible because aren't they connected? So how can we understand different states of consciousness, including sleep, without understanding the wakefulness? And I think there was a term that you've used, is called psychospiritual night blindness. And a lot of these cultural kind of maybe fear. And I think what you're talking about really mirrors this idea of like, even like the shadow and the light and the dark and the right, like this kind of one is to be feared and the other is to be revered. I really got that a lot.
You got a lot packed into that comment. Where to start? So night blindness, we try to look at sleep and dreams using waking world eyes, right? It's kind of like pulling the fish out of the water, putting it on a plank and trying to understand it. The best way to get fish, I don't know why I'm talking about fish, but the best way to understand fish is to learn to swim, right? To get into the water with them. The night blindness thing, it's sort of like trying to understand night by using a flashlight, right? We're illuminating it in a waking kind of way. It's good that we're trying to understand, but there's such a limitation to what we can see unless we learn to see through night eyes. And you know, you're mentioning shadow and the dark side of that, and I think that's one of the reasons we've sort of retreated into this wake-centric bubble that we live in, because I think we're afraid. Um, Let me just say, I struggle. I mean, I'm a psychologist and a psychotherapist, and I am so I'm very frustrated with the vast majority of my colleagues, because I just think we are remiss. You know, I'm a member, I'm a fellow in the American Academy of Sleep Medicine, and you know, so work a whole lot with what goes on in the body and the brain and the medical and the biomedical aspects. But sleep issues are primarily psychological. And we psychotherapists are responsible for that. Mental health professionals, we need to really get on board, and we haven't. You know, you probably know there's a subset in sleep medicine of behavioral sleep medicine specialists, right? And I don't think they behave very well, frankly. But these are primarily psychologists who study cognitive behavioral aspects of sleep issues. And you know, there's CBTI, cognitive behavioral therapy for insomnia. And it's extremely helpful and useful, but it's really limited, because what it does is it looks at behavior and cognition in the waking world that can get us to sleep. I think that's really important as a bridge to getting to bed. We want to understand the thoughts, the feelings, the behaviors that take us from waking into bed. It's like it takes us to the shoreline of sleep, but it doesn't teach us to swim, because sleep doesn't involve thinking, right? And this is CBT. Cognitive work is largely about thinking. You know, thinking about what we think about. Again, very useful, necessary, incredibly insufficient. You can read all the books you want about swimming, but until you get your butt into the water, you know, it's not going anywhere. And that's where CBTI stops. And again, it's an important contribution, but there's little focused on getting us into the water. And the primary reason for that, and here we go back to limitations in psychotherapy today, is there's a dramatic diminishment of interest on the part of psychotherapists in dreaming. And you know, I mean, not that long ago, even in my training, there was some focus on dreaming. Less and less today. You can get a doctor in psychology in many places, and you know, you'll talk about REM sleep, you know, which is the correlates in the brain, but virtually nothing about dreaming. And some of this is, I think, is an overreaction to Freud. I'm not a Freudian, and I think Freud went overboard in lots of ways. But I think we're tossing out the baby with the bathwater. I think psychotherapists need to show an interest in training in the expansive consciousness that we call dreaming. Dreaming is the bridge. It's the natural bridge from waking to sleep. And the reason most people don't sleep well, can't get to sleep, or can't get back to sleep, is there is this almost collective archetypal reactivity against the dream.
Yes, I want to get more into that. And also, when you talked about how we have missed the mark as mental health professionals, I 100% agree with you. I have no training other than what I've gotten outside of actually the psychology world. I've gotten my trainings in other areas, right? As far as sleep and dreaming and working with the night. But it's not, what we're doing isn't working, obviously, and not saying that we have the power to like fix every issue that exists in the entire universe, because like you mentioned a lot that there's a lot of factors that go into this, like the productivity and the lights, the constant stream of lights, and we'll get into that. But I think the last statistic I read was 50 to 70 million adults have some type of sleep issue.
Right, right.
And you're right. How are we not looking and addressing that? And many of them have co-occurring with anxiety, depression, PTSD. It shows up in almost all my sessions.
You know, it always reminds me, many years ago when I first started practice, I had this fellow coming in he was pretty depressed. He had just ended a relation, or his partner had ended a relationship. And one day he came in and he hadn't eaten in like 2 days, and I grew up with a Jewish mother, and suddenly her ghost was there, and I was really conflicted. I wanted to do therapy with him. That was my responsibility. I took him out for a sandwich, and I know I was sort of bending boundaries, but I thought, what? This is ridiculous. If we don't have the same regard for sleep among our clients or patients, it doesn't go anywhere, we really need to make that a primary focus. And you're right, I think as therapists, probably more than 90% of the people we see, unless it's sort of a standard counseling practice, but if we're dealing with clinical issues, these people are not sleeping well. And many of them will say they're sleeping well, but it turns out they're using a lot of medication, over the counter or prescription medication. And does that mean they're good sleepers? No. It means they're masking their sleep disorder.
Yeah. So let's kind of get into a little bit of what you talked about when it comes to our regards to dreams. I think that's a good kind of place to start with. What are ways to maybe approach or start to um, work with dreams that could start to like meld these consciousnesses together?
Yeah, that's really important. I think a first essential step is for all of us to pay attention to our own dreams, and there's something about dreaming. This is going to sound strange, but there's something about dreaming that's so real that as soon as we put our toes in the water, we get it. We get it. It's compelling. It's alive. It's relevant. It feels meaningful. And so the willingness to do that. And again, so many of us now believe, have been taught, and in fact, the vast majority of my colleagues in sleep medicine, including behavioral sleep medicine, psychology specialists, believe that dreaming is meaningless. It's just a sort of this accidental, flotsam, jetsam, dust cloud that's kicked up. And it's a heartbreak for me to hear that. But to get that meaning is dreaming, to get that dreaming is meaningful, we need to begin paying attention to our dreams, and it will teach us. There is an intelligence, I believe, in the unconscious that we can't deny once we open to a dialogue or a conversation with it. But that brings up a second point, and that's that why are we not doing that? I think more so than other cultures around the world. There's a survey that shows that about half of Americans believe that dreams are meaningful, but I don't know what percent actually engage that belief. But I think what's in the background is a longstanding mistrust of the unconscious. I think, this is shadow work, right? Can we really trust what's deep inside? Joseph Campbell did some wonderful work around the inner reaches of outer space, right? The parallel between how we see what is deep inside of us and how we see what is way outside of us, right? And so historically, particularly when Freudian psychology was rampant, back in the 20s, 30s, 40s, maybe 50s, we were seeing all this literature and film about these really evil characters coming from outer space. These people were coming from Mars and they wanted to steal our women and eat our children and do terrible things, Rollo May shows up and starts to say, what's deep inside of us is not the Freudian devil. It's not the id, which you might know that, Freud wrote in German, and id is a Latin word. Freud used the term das Es. What he called the heart of the human personality was it. It was it. It's like, oh God, and it's this vast repository of horrific things we wanted to do to our parents and other people. So Rollo May shows up and says, it's not a terrible thing. It's an inner child. And shortly afterwards, E.T. shows up, So it's interesting to look at that. It's interesting to consciously ask ourselves what we believe is deep inside of us and deep inside of other, because whether or not we state that, it impacts when we're sitting with another human being in a session. It impacts how I see that person. Can I cultivate a sense that there's something good inside of them, some intelligence beyond their conscious waking self, that something that we can trust, right? So I think when we move in that direction, the dreaming becomes really meaningful. And I often don't like saying this out loud, but over the years, I'm often more interested in a dream I hear from a patient than I am in their waking life. Not that their waking life is unimportant, but I feel like I'm really getting at the roots of what's going on when I hear that dream. There's depth and intelligence in it. So I guess it's a willingness. It's a willingness to re-engage the dream, to trust, to have faith in ourselves.
Yes, and in that, when we kind of talk about getting, I guess, to the deeper or like unknown spaces, I know that talking about the wakefulness piece, because there's a lot of that we can't just only focus on sleep, that also the wakefulness is equally as important. And in that, you talk about rest. And
Mm.
one of the reasons why, at least I resist rest, I can share for myself, is you're right, like slowing down and just sitting with my body and my mind, because I am mostly like hijacked throughout the day, that it's a little intense to just sit with the body and the mind. But you also talk about that rest is part of that recipe, right? And as you're talking, I kind of get into all the things that we kind of resist that are part of this dreaming, nighttime, unknown world. And I think rest is one of those. And what do you think about that?
I think it's also so easy to overlook the fact that one of the most critical active ingredients in effective psychotherapy is we're resting with somebody. So come over here, sit down. Usually we're sitting and we're resting together. Somebody needs to do a comparison between just sitting with somebody and resting versus sitting and doing therapy. I think there's some effect to just being willing to rest with another. In our world, when we start to look at sleep, we get, and there's widespread agreement, both in academic and let's say sacred circles, spirituality, that there's three kinds of consciousness. There's waking, dreaming, and sleeping. But we tend to see them as almost separate spheres. They sort of meet in different places. But in Hindu and yogic traditions, most of us are familiar with the chant Om. We often write it OM, but Hindu scholars will say it's AUM, it's Aum. It's actually three sounds. And those sounds represent the three states of consciousness. A represents waking, U represents dreaming, which I love, represents sleep, right? And so the chant Om is a sound that is suggestive of an integrated whole consciousness. And as strange as it might sound, we can be awake and dreaming and asleep all at the same time. And I think that's what whole consciousness is. And so examples, during the day, we might have this sort of this breeze of a sudden peacefulness that blows through us. When we sit down and rest, there might be a few seconds here or there. I think that's actually sleep. I think when we're truly rested during the day, it's a little bit of sleep that shows up. Certainly we can get a little bit dreamy. There can be lucidity, there can be awareness of sleep and dreams at night. So these forms of consciousness don't need to be segregated, they can be integrated. And the one place where that happens naturally for most of us every night is a state of consciousness that we sort of dismiss. It happens during grogginess. So, the word groggy comes from the English rum drink grog, and the suggestion is we wake up drunk, and drink some coffee, take a shower, a cold shower. And grogginess is fascinating. It's part sleep, part dream, and part waking. And it's so interesting to linger there. And in fact, that's one of the recommendations we offer people who want to better recall their dreaming. It's just linger in grogginess, because you got waking and dreaming, and it's all together. But we tend to jump out of bed, right? When we're experiencing this whole integrated sacred state of consciousness, an alarm goes off on our bedstand and says, get the hell out of there. Rest is a form of civil disobedience, right? Because it flies in the face of what the culture tells us. But yeah, so spending time in grogginess, I think, is a really healthy thing to do for dream recall. And it's also a kind of meditation.
Yes. Is that part of kind of the, could we say it's a part of a rest wake cycle? But I know there's so much in between there, but kind of paying attention and balancing or noticing what's happening with both of those
Mm,
cycles.
mm.
And grogginess is in there, huh?
It's a bridge. Yeah, grogginess is the bridge between sleeping, dreaming at night, and waking. And also, I hinted earlier, and I think this is so important. I'm writing an article about this now. Um, that dreaminess is the bridge between waking and sleep. Most people try to think their way to sleep, and you can't. Thinking is how we do most of waking. And by the way, thinking, most of what we call thinking is a problem-solving function. Thinking creates representational models of reality. If I want to get from here to there, I can think it ahead of time. Most of us have thinking turned on all the time. And again, so back to Maslow's notion, if all you have is a hammer, you treat everything like a nail. If thinking is turned on, if it's the default mode turned on all the time, then life itself is a problem. It's like everything we think about, oh my God, it's raining, I can't do a picnic. Oh God, it's sunny, skin cancer, it's all a problem. Uh, So yeah, I think getting those transitional bridgy states of consciousness is important. There's a lovely term used more in French and Spanish. In English, it's crepuscule. So we think of living things as being either diurnal, awake during the day, or nocturnal, awake at night. But many living things are crepuscular. They're awake during twilight, dusk and dawn. Which doesn't exist in a lot of our world, right? We've converted twilight to rush hour. We're in a hurry to get somewhere, to get back home. Um, but that's the transition in the world from waking to sleep and sleep to waking. And I think developing a relationship with, coming to terms with, being friendly with dusk and dawn, what I call crepuscular consciousness, is really important. It's extremely important for creativity, for rest, for intimacy, because that's where people can connect. Really, almost a century now, we've extended the length of the waking day by 4 hours, and I think it's had an impact on our health. I think it's one of the reasons we're seeing little girls at age 8 and 9 now start menses, because their brains, their bodies think they're that much older because they've been exposed to that much more light night after night after night. Lots of ramifications. But yeah, the willingness to be in dusk, I think initially is discomforting, as you were saying. We slow down, maybe a sadness because we didn't get done everything we wanted to get done that day, the loss of light, but it introverts us. There's a presumption in some of the earlier research that roughly 3/4 of people are naturally extroverts, and just a fourth are introverts. But that when that research was done, we were already exposed to a lot of light at night. And I suspect it's more 50-50, that a lot of people are sort of pseudo extroverts because the culture pressures them to focus on that. But to answer your question, we need to dial the lights down at night. I mean, Mother Nature is a great guide. Turning lights down, particularly, it's the blue wavelength of light that enters the eye and sends a message to the brain that it's daytime, and that actually suppresses melatonin. Otherwise, excuse me. Otherwise, there's a gradual rise of melatonin, which is internal dusk. And the other thing that's troublesome for people is that we sort of become a little ADD when things are foggy or hazy. When things darken, they're not as precise. We don't think as clearly, and we become dreamy. It's a dreamy kind, it's a waking dream kind of consciousness. And again, if all we value is sort of ordinary problem solving, thinking, waking, we're uncomfortable with that. But we can come to love that. We can, it's a beautiful experience. It's romantic. I mean, even beyond the typical sense of romance, there's a kind of emergence with the environment at that point. Much more, we're less segregated as individual beings, like we are during the day. We're more permeable at night. So yeah,
Yes.
willingness to go there, a willingness to trust that. Well, we confuse the term light and light. Lightness is considered sacred and spiritual. We talk about, heavenly light, angelic light, the light of God, and the notion of darkness is the opposite. We have the prince of darkness as the devil. The International Dark Sky Association, which is a consortium of scientists and people interested in the atmosphere and weather and the night sky and health and physicians and psychologists, is based based here in Tucson, where I live. So I'm up on their work. And Tucson is a rare city. We have 1 million people. It's a lot. But it's one of the few cities of a size where you can still see the Milky Way at night. And I think that's one of the it's an impact of the International Dark Sky Association. So there are ways of managing light, in the environment. The Luxor is interesting. I think they're trying to attract aliens to come there and gamble. uh, but yeah, we can. There's a good technology now. We can get low blue light. So in my bedroom and bathroom, I can turn on lights at night, but they're amber in color, which means they've stripped out the blue wavelength, and so it doesn't impact us the way ordinary light. It doesn't send a message of daytime to the brain. So there's great technology. There are glasses we can get, the low blue light glasses. Obviously, many people are aware now that there are apps that will actually change the lighting in your computer, which I think is really important at night. We need to think of light as being like energetic caffeine. It's great during the day. It keeps us energized, but at night we want to dial it down.
Yeah, and I think that brings us into the same kind of conversation that we've been having, but through all these different flavors of restoring our relationship with the night consciousness, or I don't know how you describe it,
Yeah,
but
right.
I think part of that, it feels like from what I'm hearing, there's so many ways, there's so many disruptions, or how we talk about ruptures in relationships.
Mm.
There's so many ruptures, it seems, to our relationship with that type of consciousness. What else do you think of and practice or suggest of besides noticing twilight, dreaming, the light issue, like reducing lights? What other things do you have you studied or talk about with that
Yeah.
restoring that relationship?
Let me share in that regard. You're reminding me, many years ago, probably 20, maybe 30 years ago, I worked with a patient who had a serious reaction to light, photosensitivity. And so she wore a lot of sunglasses. I mean, there were neurological reasons for it, but she asked me, and I was quite resistant, if we could dim the lights. She'd come in late afternoon or early evening, like last session, and she wanted the room really dark. And I was concerned, boundary. She was a young woman, and there's boundary issues now. But I let it go, and it was really interesting for me too, to realize that there's some things. So we would both go into a dreamy consciousness. I mean, we were present and rational, but it softened the edges. It was like it was like being out at night, right, with someone, and there's a different feel to that. And it reminded me of how important it was to not just see the waking person, but also to see the dreaming person, the dreaming aura around the person. And that's a lot easier to see in darkened space. There's some things we can't see in the light. Some things just show up in that. So I think about that as a therapeutic technique too, to be willing to go there. And of course, then there's the shadow element to that too, which is really critical. One of my dear friends who passed away, Debbie Ford, wrote a beautiful book. Her first book was called The Dark Side of the Light Chasers, and calling attention to how in our world, we confuse everything light with goodness. And, there's this sort of sweetness and light mentality, which causes people to deny the darkness and their shadows. So I think that's a big part of night. When things slow down, we come back to ourselves. Many of us, when we were younger, we'd go camping, and when the sun would set, we'd come together. There's a natural tendency for humans to gather together when things get dark. We're not going to run around because we're going to trip over something that we can't see. We sit around a small fire, and there's a tendency when we were kids, we'd sit around the fire and tell ghost stories, right? And I think that's a natural tendency too. There's something about the night allows shadow to come up, right? And nowadays we sit around a big screen TV and, we don't tell stories. It's a problem. So yeah, so there's that potential coming together and processing the day. I guess it's therapeutic, but it's more than that. But engaging in a social process of dealing with shadow. We all have shadow issues. We all have fears. And I think in nature, dusk invites us to do that. And I'll often say to my patients, see if you can have some of your bad dreams before you go to bed. And I think the way we keep deferring, attending to that kind of stuff, I think it worsens. There's more to process in our dreams. Jordan Peterson, who many of us familiar with, I have mixed reaction to him, but I think he's brilliant and has a lot of good stuff to offer. One of the things he reminds us of that Joe Campbell talked about, Hugh Pray, there, a lot of wise people talk about. I like the way he puts it. He says, if you're alive, you're in trouble. And it's true, it's not just, we're in trouble because, we had a bad upbringing, an alcoholic parent, or we had, irredeemable losses, or, it's a part of life. It's the nature of this world. So, and so is shadow, and so is our willingness to process that. And I think Mother Nature created opportunities for that to happen in the setting called dusk.
I love that. That's really that's a beautiful way to look at it, and not as mechanistic that I think we approach so many quote unquote issues in the mental health community, right? Like,
Yeah.
I love your discussion about using CBT and chemicals, and that's about it. Like, that's kind of as far as where I can discuss with my clients
Right.
when they're having kind of that really disruptive sleep issues like insomnia where they haven't slept in days and days. That's definitely beyond my scope. But something else that's really interesting that I've read about and am curious about is there a historical natural waking time for humans around, is it around 2:30?
You mean in the middle of the night?
Yes, and how if you find yourself waking during that time, it could be your, animal self being its animal self.
Yeah.
What do you know about
Or
that?
and or spiritual self. So
Right.
it's hard to put an hour on it because hours are artificial and they change with seasons and stuff. But there's evidence. There's some good historical research evidence, and there's what I would call sacred evidence that it's actually normal to wake up in the middle of the night. And people did it all the time when they weren't living by the sort of the social, the cultural clock. So in Kabbalah, in mystical Judaism, there's a term called Tikkun Chatzot, and it literally means the sweetest hour, and it refers to the middle of the night. There's a notion, and also in Buddhism and other places, that there's something really powerful about, there's an opening that happens in the middle of the night. Now, it's the counterpart to a closing that happens in the middle of the day, which we call the nap. We are biologically programmed to get sleepy. It's not because we didn't sleep enough or we had wine for lunch or any, we normally get sleepy in the middle of the day. We want to sleep for 20, 30 minutes. We normally get wakey in the middle of the night. Most of us override that because as a culture, we're so sleep deprived, we just kind of sleep through that. But in nature, it's probably healthy to regain consciousness in the middle of the night. It happens in a period during sleep architecture where we've completed our deep sleep, which happens in the early part of the night, and we're about to go into a lot more dream sleep. And right in the middle, there's an interesting point of awakening. Most people in our world today, when they wake up at that time, they judge it. They judge it clinically, like, oh my God, I have insomnia. They get anxious as soon as they do. They start to spin out, and there's the insomnia. But it is normal and natural to wake up. And the challenge there is not to pick up a book or turn on the TV. The challenge is to be with yourself, because yourself is really prominent. The waking mind has gotten a lot of deep rest. We're about to restart the day into the world of dreaming. So being with oneself, sitting in a darkened space, away from the bed, meditating, praying, being with what your heart is saying. It's a great time to initiate a conversation with the unconscious, and then that will continue into the dreams and the rest of the night. So yeah, it's normal to wake up in the middle of the night, but not to be
Yeah.
awake for 4 hours.
And you mentioned something about the spiritual nature or the sacred nature of sleep, and that's kind of been woven throughout our conversation.
Mm.
And I definitely think that's a conversation that doesn't happen as frequently as could or should, in at least in my field. And I'm really curious about expanding a little more on the sacred spiritual element, because sometimes, like you said, and I wish I was a little more like hip or with it to feel that way when I wake up in the middle of the night, but I do something similar. I'm like, oh crap, like here it goes, and now I'm going to be tired when I wake up. I have all these things to do, right?
Right.
But wow, what a shift in perspective of thinking of that time as spiritual and
Yeah,
sacred.
yeah. There's something about, I mean, there's a stillness that we wake up into, and we've known this for a long, long time. Way back in grad school when I was studying hypnotherapy, we learned about abreactions. Some people, as soon as they start to rest, they get anxious. And sometimes it's just a pretty acute expression, almost panicky. There's something about rest that scares us, and I think to a lesser degree, there's some of that happens in the middle of the night. It's so unfamiliar, it's so undemanding, it's so sweet. There's a bittersweetness in a sense. So Eckhart Tolle and other spiritual writers talk about sleep as being a sacred state. Most of us have been taught erroneously that we can't be conscious of sleep. Will Dement, a great sleep researcher and teacher, wrote about this book in his classic book, The Promise of Sleep, says it's impossible by definition to be aware of non-REM, stage or deep sleep. It's just not true. It's just not true. It's a strong belief, but and so this takes us into sort of meditative writings. Most of us believe we can't be aware unless there's an object of awareness, right? It's sort of like back to the flashlight. If you're shining a flashlight up into space, you're not going to see anything, right? And then there's this concept also called pure awareness. It's awareness of awareness, right? So there's nothing there. Even the word nothing, where I grew up in Brooklyn, it was like the worst thing you could call somebody, you're nothing, oh God. But of course, in Eastern traditions, nothingness is sacred. There's a recognition that there's something in nothing. Nothing is something, right? It's not a thingness, but it's so interesting to cultivate awareness of sleep. It's learning to be aware of a profound state of peace, a profound state of serenity. I love, the classic Beatles song, Golden Slumbers, if people remember, the lyrics to that. Once there was a way to get back home. Once there was a way to get back home. Sleep, pretty darling, do not cry, and I will sing a lullaby. Those lyrics were written 300 years before Paul McCartney converted into song, and they were written by a minister, and it was a lullaby. But if you look at the history of our perspective of sleep, there was a time when sleep was not thought of as nothing, right? Let me just divert for a second here. So we live in a world where sleep is medicalized. Most of us now think, what is sleep? Well, it's what your brain does. Therapy is now medicalized too. It kind of bothers me.
Mm-hmm.
But when you look at medicalization, the definitions of sleep, when you ask, classic sleep researchers or doctors to define sleep, they'll start talking about what's going on in neural networks. This quiets down, more of this neurotransmitter, less of that. So they describe a map of what's going on in the brain as if that's sleep. It's not. It's what the brain is doing while we're sleeping. But what that leads to is what I call a negative definition of sleep. Negative, not as in bad. We have a negative definition of health. What is health? It's not sick. right? It's not ill. So what is sleep? Well, it's not waking. It's not awareness. It's not consciousness. And the technical term for true sleep in sleep medicine is non-REM. What is sleep? It's not dreaming. And then we walk away, oh yeah, I know what sleep is. It ain't that stuff. But it's so misleading. And the presumption then is that sleep is unconscious and that we can't have awareness of it. But we can. And there's so many, there's an interesting history in sleep medicine. We had this diagnosis for a long time called sleep state misperception. And in my practice, it was often an older woman, maybe in her 60s, 70s, I don't know. And she was reluctant to talk about this, but eventually she'd say, yeah, I'm asleep, but I kind of know that I'm asleep. Now, if she saw a standard sleep doctor, they'd give her a sleeping pill. They would say, you have sleep state misperception. You're actually asleep and you're dreaming, you're awake, or you're not asleep. It turns out most of what we call sleep state misperception was actually sleep state perception. It's like, oh my God, people were asleep and they knew they were asleep and they liked it, it's really nice. So there's a way of cultivating that. Many people have awareness of sleep around the edges of sleep, what we call stage 1 sleep, where you're sort of awake, sort of asleep. A lot of people have this when they take a nap. Many of us had it in college when we were sleeping in on a Sunday morning and somebody tried to wake us up and we said, leave me alone, I'm sleeping. They were. So we want to begin to consider that it's possible to have awareness of sleep. And that awareness is worth cultivating because it's awareness of peace. We learn the coordinates, we learn to feel, we have this peace inside of us that it doesn't compete with waking, although it can, but it shows up readily at night. And I don't remember where this conversation started, but I like where it's going.
Same. Is that the same thing as lucid dreaming? Because remember, what book was that? Don Juan, the first book I ever read about lucid dreaming. I can't remember the name of it now. Do you know what I'm talking about?
He wrote,
Carlos Castaneda books.
Castaneda wrote, yeah, like a half a dozen books, yeah.
And I was like, oh, lucid dreaming, that seems like something you want to do, and it sounds freaking cool that you could just be in it. Is that the same thing or something different?
It's similar. So there's actually 2 parts to lucid dreaming. There's lucidity, which is being aware of it. And I wrote in my first book about lucid sleep, which is a term that isn't commonly used. But yeah, so what we're talking about, you can be asleep and aware that you're asleep. And it's kind of cool. So the thing about lucid dreaming, the Tibetan Buddhists have one of their paths is called Tibetan sleep and dream yogas, and these monks are devoted. And this is an arduous path to using sleep and dreams as a means of awakening spiritually. The Dalai Lama years ago famously said, people thought he was joking. He said, sleep, the best meditation. But these monks are taught to be aware of the dream, but they are admonished not to change it. And this is a really critical point. In our world today, man, we want to just, we want to control the dream. We look at the dream as a natural resource. I've been approached by a couple of companies that wanted me to work with them on, they're creating really interesting technical devices to increase lucidity so that people can use the dream, right? So being aware is one thing. It's like, oh, wow, this is so cool. Using it is another. And in the Western world, lucidity automatically suggests to people that they're going to be able to control their dreams. I want to say there are moments when we're dealing with severe PTSD nightmares when it's merciful to teach somebody to have some control. But by and large, we don't want to control our dreams. We only want to control them when we think we're smarter than the dream. Like, I'm smart. And we think we're smarter than the planet. We control natural resources. We've torn the planet apart in terms of, harvesting, lumber and water and minerals and so on. So I think we need to approach the dream with a lot more respect and recognize there's a wisdom there in the unconscious, and it's wanting to communicate with us. We don't want to baffle it. We don't want to tear it apart. So I love Castaneda's work, and it's a whole different context. Um, one of the great things he said is what dreaming does is it gives us the fluidity to enter into other worlds by destroying our sense of knowing this world. And that takes courage. It's like, oh my God, I'm going to be able to see through the wall. The structure of waking is going to dissipate. It'll become permeable. But I have to be willing to let go of what I thought was solid, and trustable, and a deeper world is revealed.
Mm, I love that. I love that. And I know we've kind of gone all over the spectrum a little bit. And I know that in an hour it's hard to touch on these concepts. And I really love the two books of yours that I've read are Hush and Healing the
Night,
Darkness.
healing
Am I
night.
saying Healing Night? Yes. And also I've been had the pleasure of being at a conference where you were presenting, and that's where I first found your work. And I was like, I've never thought of sleep this way or night consciousness. And I've also given, I think you have something that's downloadable for free on your website, and I've given it to multiple clients, and they're like, let's talk about that. Like they want to come into session and really explore this
Yeah,
work. So
cool.
anyone that is interested in exploring more and maybe finding some resources, you want to share what you would recommend?
Yeah, I'm doing less travel. Some of that started with the pandemic. So I'm no longer teaching in Europe. I was doing that every year. But for professionals in particular, for mental health professionals, my favorite and my most comprehensive training is at the Cape Cod Institute. So that's scheduled this July. It's a 5-day program. It's mornings only. Um, and yeah, it's a wonderful opportunity to couple a vacation with that. And I have to say it's my favorite thing. The dialogue. First of all, people self-select to that, and it's just a wonderful group of people that show up from all over the US and North America. So that's available. There are shorter programs that I also like. I go to a yoga ashram in the Bahamas twice a year at Shivananda in Nassau. And there's less lecture, there's more interaction. There are workshops there, and it's a lovely place. It's just a lovely place. Um, and then also coming up for therapists who want to come back to the world of dreaming, there's the International Association for the Study of Dreams, IASD, and it's truly international. Our conferences go back and forth from Europe to the States. This June, we're meeting in Ashland, Oregon, and it's a wonderful conference with some of the top brain neuroscientists, like the Stanford, Yale, Harvard folks, and Oxford on the one hand, to shamans from Peru on the other, artists, and a lot of psychotherapists. It's just this wide, heart open space in dealing with dreaming. So it's a wonderful place to meet like-minded people as well. So it's a large program. There's a lot going on there. That's in June. So I think that's what's coming up.
And
It's all
any
on my
other
website as well.
Yeah, so going onto the website, that sounds amazing. I'm gonna look that up actually. And what about as far as like reading materials? Where's a good place to start?
Yeah. Um, I've written a number. So most of my teaching here at the University of Arizona is in the medical school. So a lot of the writings they're a little more technical, but I think accessible to psychotherapists. So there's a relatively new book called Integrative Sleep Medicine, and I've written 2 chapters. I've done a lot of input on other chapters now, but there's a chapter called Dream Medicine that I really love. And my favorite chapter, the last chapter in the book I wrote, is called The Future of Sleep and Dream Medicine. And I think it's a really nice sort of depth overview of what's going on in the field today. And again, where therapists can take it. I'm reluctant to admit this, but my unconscious is beginning to bug the crap out of me about writing another book.
Yeah.
We're having a dialogue. I'm saying, you write it. And saying, no, I can't write. But it's possible that a book, anyhow, it's coming out as an article first. But again, as I said earlier, and I just want to emphasize, My deepest wish is that psychotherapists, mental health professionals of all sorts would really get that there's a niche for them. I mean, not just in terms of like building practice, which it would do, but also in terms of deepening the quality of the work we do. I think it's virtually impossible to thoroughly heal mood disorders, anxiety disorders, and depression unless we pay a lot of attention. I've written that sleep and dreams are the roots of the tree of waking life. So it's like trying to take care of a plant with ignoring its roots if we don't attend to sleep and dreams.
I agree. And thank you so much for sharing that, because part of the integrative approach that we're hoping to align ourselves with is that idea that just like an ecosystem, it doesn't, nothing exists in a vacuum, how interwoven all these systems are. And it's so easy to like just say, well, I specialize in this one particular part, right? And I think the same thing for mental health professionals of like being aware of all the different systems that come into play. And I think that this particular system of sleep, nighttime, dreams, and just consciousness in general, at least in my area of practice, isn't discussed. It's more so like what intervention is hot right now, or like, and that's all good and well. But I think also for us personally to look at it in our own lives and restore our kind of integrated wholeness, I guess is the good way of putting it.
I so appreciate your saying that. I think there are elements in sleep and dream work that are core to psychotherapy. For example, one of them is I mean, we might think of it in terms of the serenity prayer, but it's the issue of knowing when to surrender. And many of us are caught in thinking, and we're thinking our way. And people end up co-compulsing. There are all of these recommendations of things to do and not to do. So they're checking off things in their head. And that's not a great energy to bring to bed. Falling asleep, like life is more of an art than it is a science. The science can inform us. Mary Oliver, the great poet, has, in terms of reading, I frequently recommend to my patients that they read this poem every night. The poem is called "Sleeping in the Forest," and it's the best succinct overview, depth overview of what sleep is about that I've ever read. And you also get in that poem that despite common notions, we don't sleep alone. Sleep is a shared phenomenon. We sleep with the world around us. And so, she says, I thought the earth remembered me. She took me back so tenderly, arranging her dark skirts in lichens, pockets full of lichens and seeds. So there's a sense that we return to the earth. It's so interesting too, because when we sleep, we get horizontal. And the head is no longer above the heart. There's an evenness, and we're all about the same height when we go to sleep. It evens us out. So there's this beautiful sense of humility of going down, and she talks about grappling with a luminous doom. There's a sense of rising and falling, and then she finishes the poem talking about how she slept as never before. There's just something about returning. We return the body to the earth. There's an interesting spiritual notion too that's borne out, that science is beginning to reinforce, that metaphorically the soul leaves the body at night. And what we know in brain studies recently is that there's a disconnection between executive prefrontal cortical function and lower limbic, hippocampal and limbic function. So during the day, like right now, our executive function runs the body. The body can say, excuse me, I need to pee. And, we can say later, or I need to eat, or I need, we run the body. But what happens is in dreaming is an out of body experience. The mind leaves the body. And I say that because, so right now, waking consciousness is shaped by being in a body. It's shaped by our sensory input, the things we see and hear and smell and touch, that shapes input, and by our motor output. So my consciousness resides in this body. When I go to sleep, I shut down my senses. I close my eyes. That's huge. I stop listening. I stop feeling. And of course, we lose motor ability, rematonia. We become paralyzed. There's really nothing going in, not much going in, and nothing going out. So, and there I am, and I'm no longer in a body, and now I can fly. You know, I become permeable. And we talk about boundary issues. I can be you in a dream. Uh, there's just this incredible expanse. And I think the spirit needs that. I think it's really hard to be locked in a body 24/7. It's like taking off a pair of tight shoes. Like, but the other thing is the body loves it too. The body, which is, it's like an animal on a leash in some ways all day. When the mind metaphorically leaves the body, it goes through what we call autonomic nervous system storms. Things get really wild in the body. Heart rate goes up and down. Respiration gets wild. Body temperature is up and down. It's almost like when the mind leaves, the body kind of shakes it off. Like, whoo. The other thing is, no matter what we dream, it can be a nightmare, it can be a pleasant dream. We get sexually excited. When the mind leaves, men get erections during every dream, the women lubricate. It's like, that's what the body does. That's how the body connects with other bodies. So the body and the mind, in my opinion, are not one, although it's a popular notion. They're connected. It's a mixed marriage, right? And like any good marriage, they need a little bit of time apart. So if we don't dream well, it hurts us. It hurts our health and our mental health. We've known for years that there's a link between poor patterns of dreaming and mood disorders, particularly clinical depression. And I should add, a lot of my research in recent years has been focused on the fact that I believe most of what we call sleep deprivation is actually dream deprivation. In sleep science mixes the two. We refer to dreaming as a kind of sleep, but when we look closely at it, we're in the middle of a silent but raging epidemic of dream loss. And I think that severely constricts consciousness. Huxley, many of us know, Aldous Huxley talked about, wrote a book called The Doors of Perception. The doors of perception are now peepholes. We're living in smaller and smaller visually framed experiences of the world. We need to dream. We need to sleep. We need to dream, maybe even more than we need to be awake.
But yeah, I'm gonna process that, and I think that a lot of our listeners have a lot to compost and digest and explore.
If I
I'm
could say
so
one
excited.
more thing about
Yeah.
that. I mentioned medicalization and the way we look at sleeping and dreaming and consciousness, and I mean, in medical terms. What it does is it depersonalizes life. It depersonalizes sleep and dreams. And it's huge in science now, is that there's been such disregard for experience, uh, including thinking and feeling, but more than that, just the notion that my experience is of value, that there's something wise and intelligent, behind all of that. There's a great article written by a group of renowned scientists, including my colleague Gary Schwartz and Frontiers, about how science has become warped because of this profound disregard for personal experience. Yeah, and today, there's such a strong proclivity to reduce experience to brain function. I have a patient coming in saying things like, my amygdala made me do it. It's like, I know you got an amygdala, but that's not what's going on. And and when people think of the brain as sleeping and dreaming, it's a mistake. We do. It's a personal experience. I sleep, I dream. My brain does a thing when that's going on, but it's not what it is.
Yeah, I'm glad you made that point. Thank you. And yeah, I know our time is coming to a close. And I'm just curious if yeah, there's anything else on your heart or on to speak before we close.
I think I would just reinforce, I would encourage people to trust that I think we all have elements of healing inside of us. And the more we move on trusting the deeper parts of ourselves, the more we begin to trust that in others. And it's lovely. I mean, it's not about being naive and submitting to stuff that's not safe. But it's about being able to see more deeply into the human spirit. I also think, and interesting to see what you think about this. Most of the time I sit down with a client or a patient, when they're sitting in my office across from me or inside the computer, as the case may be, they become healthy. And one thing I learned a long time ago from watching Star Trek, any Trekkies out there, there's a thing called the tractor beam. So sometimes the ships would be floating in space and one of them would just send out this energetic tractor beam and it would capture the other one and kind of draw it in. I think when we sit with another person, we are sending out a tractor beam to aspects of that person. When I look around and I find the healthy, sweet, loving, creative, artistic, beautiful part of another person, I silently lock down on that, and I speak to that no matter where they wander. I find who I think they really are. I think we can do that in life too. We can come to get that that's inside of somebody, and we can attend to that. And I think it serves everybody. It serves us in reminding us of who we are, and it serves whether they're our clients or friends or family. And I think sleep and dreams are at the heart of that, because they're profoundly serene and profoundly creative.
Thank you so much. I want to be really respectful of your time, and I appreciate you. And I've been loving reading more and more. I know that you've probably already moved beyond what you've written, or have different thoughts, but I've been loving it. The Hush, I was like, this is cool. I'm going to read at least 2 of these a night and just see what happens.
Can I make a suggestion?
Please, yes.
Read one.
Okay. See,
One
look, I wanted 2.
I know I'm gonna cut your velocity in half, right? It's a pretty terrible recommendation, but see what you can do.
Okay, I'll go with that.
I'm
Thank
happy.
you.
Yeah, but thank you. I really
Yeah.
appreciate your presence to this work. It means a lot to me. Thank you. I hope our paths cross again sometime.
Absolutely. And have the day you're going to have.
I appreciate that. Thank you.
Peace.
Take care, Jen.
Ciao.